Welcome to Legacy Magazine presents Black Health, a weekly talk show discussing medical issues afflicting and impacting the Black community. Now introducing our host, Dr. Michelle Kirwan Blythewood.
Heart disease is the leading cause of death in the United States, and risk of heart disease differs by race and ethnicity. Are you at greater risk? Stay tuned to find out. Good afternoon. Thank you so much for joining us, and welcome to Black Health, a platform to discuss illnesses affecting the Black community. I am your host, Dr. Michelle Kirwan Blythewood. I'm a board-certified pediatrician and the chief medical officer at the Pediatric and Family Health and Wellness Center in Miami Gardens. And today we are talking about heart disease with cardiologist, Dr. Adedapo Iluyomade.
Thank you for having me. It's a pleasure to be here.
Welcome, and it's a pleasure to have you. We thank you so much for taking time out of what I know is an extremely busy schedule, Dr. Lluyomade. I might have to refer to you as Dr. Adedapo. Might be a little bit easier,
yeah,
if you don't
absolutely.
mind. All right,
No
so
problem.
let me take a moment to introduce you. Dr. Adedapo is a preventive cardiologist at Miami Cardiac and Vascular Institute, part of Baptist Health. He specializes in preventative cardiology, clinical lipidology, and cardiovascular imaging. Prior to joining Baptist Health in 2022, Dr. Adedapo served as a non-invasive cardiologist at the University of Miami Miller School of Medicine after completing his fellowship training at the same institution. He holds a Master's of Business Administration from Plymouth State University and is a fellow of the American College of Cardiology, where he serves as the board of the Florida chapter. Again, welcome. And before we dive in, I just want to let our audience know that they can put questions in the chat, and we will answer those questions as we go along. So as we get started, tell us a little bit about what you do in the field of cardiology and what led you to pursue a career in this field.
Thank you for the kind introduction. So what I do in cardiology is essentially prevention, and it's preventing the complications of heart disease, and even more importantly, preventing the risk factors that lead to the development of cardiovascular disease. That's my passion. It's what I've been doing for some time now, and hope to continue doing for a long time. How I got into cardiology was honestly, when I was in medical school, cardiology and cardiac physiology just made sense to me. I found it very interesting. It was something that I enjoyed studying, and I tell students now, think about going into what you enjoy reading about outside of school or outside of work. That may be your calling. And for me, it was cardiology. So the space, the field is growing rapidly. There's a lot of technology. There's a lot that we know now that we didn't know 10 years ago or 20 years ago. And so that keeps it exciting and engaging. And that's why I love it.
Right. So let's start with the basics. What is the function of the heart? What is the heart supposed to do for us?
So the heart has several functions, but the primary function is really to deliver blood and nutrients to the rest of the body. And so you have two chambers which collect blood from the lungs and the body, the oxygenated blood, and deliver that oxygenated blood to each of the organs. And so when we think of heart disease, it really comes down to how these processes are affected and the organs that suffer as a result of it, including the heart itself.
What are some of the most common types of heart disease, and which one is ranked number one?
Yeah, so the most common type of heart disease that we see in the developed world is coronary artery disease. And that's disease that develops over decades in the arteries that supply blood and oxygen to the heart itself. And so these arteries sit in what we call the epicardium, or they sit on top of the heart, as you can see in the image. And they supply the muscle, they supply the motor function of the heart. And so beginning as early as 9 or 10 years old, we start to develop fatty streaks in the walls of the arteries. And then depending on a number of factors over the course of our lifetime, those fatty streaks can then become more complex plaques. And that plaque can ultimately either obstruct blood flow in those arteries, or the plaque can become unstable, rupture, and cause a heart attack. And so that's the most common type of heart disease. But heart disease also includes electrical problems. It includes valvular heart disease. It includes problems of the muscle and the squeezing or pump function of the heart, which we call cardiomyopathy or heart failure. And so there are a number of different conditions that are encompassed by the term heart disease.
You mentioned heart attack and coronary artery disease leading to heart attack. So one of the things I want to touch on, because I think many women don't believe that they're having signs and symptoms of a heart attack, and they tend to ignore. And I think people just think of heart attacks as happening to men. Can you touch a little bit on heart attacks in women?
Yeah, so this is a very important topic in cardiology today, and one that will be extremely important going forward, and that's heart disease in women. And it's not heart disease is not a disease that solely affects men. Women are absolutely affected in probably a greater degree than we fully capture or understand, or that is published in the literature. And the same processes occur in women, but the presentation is different. So, when women present with symptoms of heart disease, it may not be that characteristic clutching the chest, severe chest pain or chest pressure. It may just be as simple as shortness of breath, or a burning chest pain, or something that feels more like regurgitation, like a GI problem. It may be sweating. So it's important for us to recognize that heart disease affects men and women equally, and detect those signs and symptoms early in both populations.
Mm-hmm.
Sorry.
No, go ahead.
Another condition that affects women, that I think we understand more and more of every year, it seems like, is microvascular disease. So in the image you showed, we have those large coronary arteries. We think of those when we think of bypass surgery or stents, or people having heart attacks in the large arteries. But those arteries also have smaller branches that branch deep into the muscle. And those branches, just like if you think of the distal branches, or the ends of branches that you see on a tree, they're very small and difficult to reach with catheters. We're unable to bypass them, but they also develop disease and also cause symptoms. And so, a very common presentation is a woman who presents to the ER with chest pain that appears to be typical. But when we do the test, we don't see any significant disease in the large arteries. But it's important for us to recognize that women, especially, and there are other populations of people who are affected disproportionately by microvascular disease, may have this type of disease, and it deserves to be treated and to not be dismissed when people have those symptoms.
Now, Adedapo, I'm going to go ahead and admit that I, at one point, had some left-sided chest pressure. I was actually at work, and I called one of my best friends who's a pediatric cardiologist, and I told him, I'm like, I'm stressed. I know I'm stressed, but I'm having this, and he said, you need to go to the ER. And I'm like, I can't. I'm working. I have staff. I have this. I have that. I have meetings. I have phone calls. And what do you mean go to the ER? I'll be there for hours. And I couldn't believe the words were coming out of my mouth as I was saying it, because the doctor in me was like, are you insane? You need to go to the ER. I still didn't go to the ER. I got in my car, I drove to his office, and he did an EKG for me. And it was fine, but I still shake my head like, you are that woman that, is
it's
your symptoms.
Yeah, it's it's changing the mindset. The same thing for young people. If you're a young person and you get chest pain, the last thing you think is that I'm having a heart attack. You think, oh well, maybe I worked out a little too hard yesterday, or maybe it's something else. But it is important to recognize symptoms that seem different than the norm, than your normal symptoms, and symptoms that persist or don't go away, or that are increasing in severity. It's important to get checked out and to see a professional.
You'll be happy to know I did follow up
Yeah.
with a cardiologist.
Great.
So what is the difference? I know everybody was, the country was on edge when the football player, I think his name was Damar Hamlin, dropped on the field, and a lot of people thought that he had a heart attack. What is the difference between heart attack and cardiac arrest?
Yeah, so this often gets misconstrued or lumped together. Damar Hamlin suffered what's called sudden cardiac death or cardiac arrest, and cardiac arrest is often a sudden cessation or stop of cardiac function, so that the heart itself, for whatever reason, stops pumping and stops delivering oxygen, blood, nutrients to the organs, to the brain in particular, which causes people to usually lose consciousness, and then for the organs to start failing rapidly because of that lack of blood flow. And in the case of athletes, usually what's causing this sudden arrest of heart function is an electrical problem. And so there are certain heart rhythms that can occur. Some are genetic, some occur, due to changes in conditions within the body, electrolytes, medications, etc. But these few arrhythmias or abnormal rhythms are not compatible with life. When the heart goes into that rhythm, it doesn't pump, it just quivers. And therefore, there's no blood flow to the brain, no blood flow to the organs. When someone has a heart attack, what's happening is that one or more of the vessels that has plaque, or in rare cases, maybe doesn't have plaque, but one of the vessels suffers an abrupt block of blood flow through that vessel. It's usually a single vessel. It can be more than one vessel. And that is a situation where the heart is still pumping. The organs are still receiving blood, so it's not a cardiac arrest, but the heart is getting a decreased amount of blood flow to the area that's supplied by the blocked vessel. And so that causes chest pain. It can cause that part of the heart to die, the muscle to die. It can cause complications such as one of these fatal arrhythmias or abnormal rhythms. It can cause heart failure, etc., if it's not treated very quickly. And so when it comes to heart attacks, we say time is muscle. Every minute, every hour counts. At about 12 hours, the heart muscle will start to die if it doesn't receive blood flow. And so there are two different conditions. One needs urgent, emergent CPR to resuscitate the heart. The other one needs urgent or emergent, what we call revascularization, or opening up the blocked vessel.
So I know, a lot of parents of athletes, and especially football players, that saw what happened to Damar. I'm sure they worry about their child who's playing, a high impact sport. Is there a recommendation for clearance for all athletes, or EKGs for all athletes or football players? Or what do parents who watch that, what do they do? Just
yeah, Yeah, this is a very contentious topic in the world of cardiology, pediatric cardiology, sports cardiology, which is an emerging field. And that is the issue of screening and what is the appropriate amount of screening, what should we do, what's the right age, etc. Now, in Europe, they're a little more aggressive with screening than we are here in the States. There currently is no mandate for your adolescent child, in order to play high school sports. You do not need an EKG or any more advanced imaging or something of that sort to screen for heart disease, because the rate of these conditions that lead to fatal arrhythmias are so low, that current guidelines don't recommend screening everyone. However, as we've all experienced, just one of these episodes, in my opinion, is too many. And I think what people can do is, one, have a primary care physician, a family physician, or pediatrician, someone who can listen to the child, who can do a proper physical exam, pick up on any early signs of disease. Also knowing your family history. So a number of these conditions run in the family. So if you have a family history of someone who's had sudden cardiac death, or someone who's had a cardiomyopathy or an abnormal heart, a large heart, or who's drowned unexpectedly, someone's a good swimmer and they drown. Um, these are telltale signs that there may be something going on. And that may prompt your physician to do an EKG or to do, a more in-depth examination or diagnostic workup. But currently, there are no absolute guidelines, which may change in the future. But
one more question around
Mhm.
the athlete and cardiovascular health. A lot of these athletes are taking supplements, especially these high energy caffeinated drinks, even just coffee. But are these safe? Is there any cardiovascular risk associated with these drinks?
Yeah, great question. Another contentious topic, and I think if you follow the cardiovascular literature, you'll note that every 3 to 6 months there's a study that uh, uh, pulls us one direction or the other with regard to coffee, especially, but caffeine and caffeinated drinks. Some studies show that they can be cardioprotective, and then some studies show that they actually increase the risk. I think what's important is one. I think the most important thing is moderation.
Yes.
So you don't want, we know for sure that when you overdo caffeine, it can be detrimental to your cardiovascular health. And so the first thing is moderation. If we look at all of the literature currently, there's a sweet spot that's probably somewhere in the 3 to 4 cup range of coffee per day that may confer some benefits, with respect to cardiovascular disease and reducing risk. However, um, this comes with the caveat that if someone has a pre-existing condition, like you have, an enlarged heart or a thick heart, if you have an abnormal heart rhythm at baseline, or you're at risk for having an abnormal heart rhythm, then caffeine may be just that trigger to push you into, a dangerous situation. So once again, having a physician, knowing your medical history, knowing your family history can help you avoid some of these complications. But what we recommend is moderation. Um, there are some supplements that that overdo it, so you need to know your supplements. Currently, in the United States, supplements are not regulated the way that prescription drugs are regulated. So you need to know your source, know what's in the supplements. Uh, if all else fails, or if you're not sure, consult with your physician. I have patients who email me pictures of their supplements all the time. I have an email waiting for me right now from a patient who sent me the supplements that he's taking. And we can look at it, we can research it, we can consult with our colleagues and decide if it's safe for you to take that.
That's great that you do that. I like that.
Yeah,
But I agree with moderation. That's something my mother has always said, everything in moderation. And she's 80,
absolutely.
80 something now. So I won't throw her age out there, but she's up there and doing well.
Yeah.
So moving back to just primary heart disease, what are some of the risk factors for heart disease?
Yeah, so the risk factors that we know now increase your risk for heart disease are high blood pressure, diabetes, um, and being overweight or obese. Uh, when I say diabetes, I mean high blood sugar, high cholesterol, uh, and then we look at now we know that abnormal sleep, either abnormalities in sleep hygiene, so sleep quantity and quality, can increase your risk of heart disease. We also know that increased stress levels or chronic stress can increase your risk of heart disease. Smoking is a big risk factor for heart disease. And then we know that some mental health conditions are associated with increased risk of heart disease, such as depression, bipolar disease, etc. So the main ones that I think we all hear about are weight, sugar, blood pressure, cholesterol, smoking, um, and I think the newer ones are sleep, stress, etc.
Sedentary lifestyle.
Yes, sedentary
Mhm.
lifestyle.
So is cardiovascular disease more prevalent in the Black community? And why is that, if so?
Yeah, that's a great question. So, yes, cardiovascular disease is more prevalent in the Black community. The why is a complicated or a complex um, uh, question to answer because it involves a number of factors. So, we know that African Americans are 30% more likely to die from cardiovascular disease. They also have a higher incidence of cardiovascular disease in the United States. Um, but we also know that the risk factors that we just mentioned that lead to heart disease also disproportionately affect African Americans as compared to non-Hispanic whites. So why is this? Well, we have studied over the past few years some of these what we call social or um, uh, barriers to health or factors that lead to adverse health outcomes, and those include uh, chronic psychosocial stressors, access to care, uh, biases within healthcare, and the way that African Americans are treated, the the um, the access to primary care physicians in communities, access to good food or quality food. All of these things lead to whether or not we see these disparities between populations. And so um, uh, part of what, uh, I'm part of an association called the Association of Black Cardiologists. Part of what we do is try to tackle some of these social aspects of health and bring care to the communities. Find ways to deliver food, quality food, to communities that don't have it, provide transportation, provide education, and provide screening. And so, you know, there's there, there are those aspects, and then we also know that there are some populations of people who of African Americans. I'm Nigerian myself, and so there are some things that, as a Nigerian, I'm more at risk for than someone who is an African American or someone who grew up in the South or who has ancestry from the South may have different um, genetic risk factors from someone who grew up in the Northeast or someone who grew up or who family descends from the West Coast of the United States. So, with respect to hypertension, especially, we know that there's some genetic predispositions for hypertension. But a lot of it, honestly, is these social aspects of health.
Social determinants.
Social determinants, indeed.
Yeah. What are some of the warning signs for heart disease? Like, what should we look out for in ourselves and our loved ones? And what does that look like, just in the layperson's life? Like, I find that I'm having to sleep up higher on pillows, or so what types of things or trigger words? I mean, obviously, I feel like I have an elephant on my chest. I think everybody knows that one. But what are some of the warning signs that we may have some heart disease?
Yeah, so it depends on the type of heart disease, and we talked about some of the types earlier. But uh, you know, like you mentioned with the pillows, for someone who is at risk or developing heart failure, having to sleep on three pillows or having to prop yourself up, or someone who ends up sleeping in a recliner because they feel more comfortable there than laying flat on the bed because they feel more short of breath when they're laying flat. That is certainly a sign. Noticing that their legs are swelling, usually both legs, feeling like you can't do the same amount of activity that you were previously able to do, but it seems disproportionate to what you're doing. So let's say you were able to walk 2 blocks, and yeah, you haven't been to the gym in a while, and you know kind of how that feels. But now, when you walk 2 blocks, you're only able to get halfway before stopping and needing to take a break. That may be a sign that the heart is suffering in a way. I think some of the other early signs are obviously uh, uh, feeling your heart beating irregularly, or what we call palpitations, can be an early sign. Someone who feels chest pain, obviously with stress or with activity, is definitely a sign. But when we, in my world, in the prevention world, we're oftentimes dealing with patients who don't have symptoms. So I would say that the earliest sign of heart disease is really found in the diagnostic testing and that your physician does, and not necessarily in how you feel. Um, Picking up on a high cholesterol or early signs of diabetes, prediabetes, early picking up on an EKG that's abnormal early, and now we have great early detection tools such as the CT calcium score that can detect plaque formation in the arteries very early on, and you can do something about it before it becomes a problem. So I think the best way to prevent heart disease is really having a good primary physician, knowing your numbers, taking care of yourself, exercising, eating right. I always tell people that your body will speak to you, and so if you're moving, if you're exercising, when something is wrong, you'll feel it. You'll be able to notice it. Um, I was able to run around the block last week, and now I can't do it. What's wrong? I'm gonna go see someone. So staying active will really help you in more ways than you think.
What are your recommendations for improving or maintaining good cardiovascular health?
Yeah, so I think you know think the two main tenets of maintaining cardiovascular health are going to be diet and exercise. And when we speak about diet, um, diets are different for everyone. There are varieties and there are cultural varieties, there are varieties within homes, but it's important to maintain a well-balanced diet. What we recommend is the Mediterranean diet, which is a diet that's rich in fruits and vegetables, whole grains, fish, marine fish, still includes some red meats, leaner meats, but really rich in fish and poultry and vegetable proteins. But the large part of it is making sure that you eat enough vegetables and enough fruits. As far as exercise, we recommend currently that um, people do about 150 minutes of moderate intensity exercise. Now, what does that mean? Well, 150 minutes is not all in one fell swoop. I tell people break it up however you like, whether it's 30 minutes 5 times a week, if you want to break it up into smaller intervals or larger intervals, but getting that 150 minutes is very important. Um, and moderate intensity exercise is exercise where you can pick up the phone and say, hey, I'll be home in 15 minutes, make sure dinner's ready. But you're not picking up the phone and carrying on a full conversation. So you want to be, you want to be working enough that you're a little breathless, but not, you should be able to answer the phone and say a few words. But not there talking about the Sunday night show that you watched.
I'm laughing because I used to do the insanity workout, and I would literally be on the floor and completely breathless.
Yeah.
It wasn't advisable, but I used to love it.
So if you're going to do insanity, we recommend cutting that time down to 75 minutes. So,
Okay.
I'm a fan of high intensity interval training. It's a lot of work in a small amount of time that works for my schedule. And so 75 minutes of that is very good. But, when it comes to activity, I oftentimes will show patients a chart where we look at physical activity and mortality. And the benefit that you get from going from nothing to a little bit of something is huge, and even greater than the benefit someone who runs for an hour every day gets from increasing that hour to an hour and a half. The benefit that they receive from that increase in activity does not compare to what you get from getting off the couch and moving. And so the early part of that curve is where we see the greatest benefit. And so doing something is better than nothing. And, it's sometimes 150 minutes sounds intimidating, but I would be happy if someone who did 0 minutes did 30 or did 60 in a week. You take it step by step, and eventually those routines become habits.
Okay. So aside from diet and exercise, I'm going to put the plug in for no smoking and for sleep, like you mentioned, because sleep has not only does it improve or decrease your risk of cardiovascular disease, it also decreases your blood pressure, obesity, depression, dementia, cognitive disease. So I am a big proponent of getting really good sleep. That's something that's so important to me. So Dr. Adedapo, you were awarded a COVID Innovations Grant from the Association of Black Cardiologists. What are you doing with this grant?
Yeah, so the grant that we received from the ADC was, our project was to tackle misinformation during the COVID era or the COVID time period, and even after. And so what we're doing is educating youth on vaccines, COVID-19 and how it's transmitted, on overall prevention and healthy living strategies, hygiene, etc. And then having the youth then share that information using social media. So we educate them on how to use social media, how to create an Instagram page, how to create content that's engaging, and then they go out and they share. We reward them based on the engagement that they receive on their content. So it's really tackling misinformation at the heart of the problem or the root of the problem. Where that battleground really is on social media. And so we were able to use the funds to develop these programs to hire content creators to teach the kids. And so our program is called Youth Tackling COVID-19. We focus on children or youth age 10 to 15, 16, and help them spread correct information.
Correct. Yeah, it's very important. That's the important word, correct information. That's a really great approach. I love that because you are using kids to spread the message, and I think young kids don't really listen to adults sometimes, especially when it came to the COVID vaccination. I had a patient that didn't want it, and I was trying to teach her about the vaccine, and she was like, "Well, I saw on TikTok." And I was like, I'm your pediatrician standing here in front of me, and you're telling me what you saw on TikTok. So I really love that you use children to give the message to other children. I think that's brilliant, and I might have to use that in some way, shape, or form in the future.
Absolutely. I mean, what you're doing with this show, I think is important. Media outlets like yourself and others are the way that a lot of us get our information, and it's presented in a conversational manner in a way that people can relate with, and it's super important.
Well, thank you. And thank you for the work that you're doing. I love that you're a preventive cardiologist. I think there's so much that we don't do with prevention in medicine. We are behind the 8 ball and trying to backtrack and get our health back in order after we've, gone off the path. So kudos to you for that. I love that. And thank you for the information that you brought to the show today, a wealth of information. Thank you for your time. I know that you're a very busy physician. It's a pleasure having you. I'm going to say a quick word of thanks to our sponsors. Black Health is brought to you by FAMU Medical Marijuana Education and Research Institute. Get credible information and engage in a safe space to learn and talk about cannabis. Educate, learn, and talk about cannabis in Florida. And please join us for Legacy Magazine's other shows. Mondays, The Business of Black Business at 1 p.m. with Jay Reynolds. Tuesday, My Money, Your Money at 7 p.m. with Bridget Lumpkins. Wednesday, Soul at 7 p.m. with Nikki Gellin. Thursdays, Lunch with Legacy Leaders, 12 noon with Anne-Marie Sorrell. Taste of South Florida on Thursdays at 7 p.m. with Chef Irie, and Black Health hosted by me, Dr. Michelle Kerwin-Bythewood, Fridays at 2 p.m. So we look forward to seeing you on the rest of our shows. Again, Dr. Adedapo Iluyomade. I think I got it.
Yes. Yep.
Thank you once again for joining us. It was a pleasure having you. And I thank you on behalf of our audience, and to our audience, thank you for tuning into Black Health. And we will see you next Friday at 2 p.m. Take care, everybody.